Other mental disorders that we see quite frequently are anorexia. Now, anorexia on its own is a lack of appetite, and we see that with illness. There's a condition called anorexia nervosa, which is where you look at yourself and you consider yourself to be obese, or there's something wrong with your weight, and you want to be skinny like the people in the magazines, so you stop eating because you want to reduce the size that you are. Okay? That is a mental disorder. We tend to see that more in females than males, and it's usually adolescent females that get this. The point to understand with anorexia nervosa is the fact that these people in the magazines don't really look like that. A lot of photoshopping goes on, and they're not happy people to start with. Be happy with your size. Realize that if you are larger than you should be, you want to bring your weight down slightly to be healthier and have a longer, better life expectancy, that's great. But don't put yourself in a situation where you develop a mental condition like anorexia nervosa. Another condition we have is bulimia nervosa, which is where you eat food and then you feel guilty about eating, so you make yourself throw up and get rid of the food because the excess calories aren't needed. Another form of this is using laxatives to get rid of the excess calories. So you'll eat the food and you take a laxative, then you go to the bathroom and have diarrhea to get rid of it. Another condition we have is binge eating disorders, where you're dieting consistently, then you go off the diet and you just binge eat and eat as much as you can, and again you're back on the diet. The way to lose weight healthily is to actually eat multiple meals a day, reduce the number of calories coming in and exercise, and burn off extra calories. Okay. Again, this is one of these conditions that tends to affect younger people because they have an ideal in their mind that's put there by the media, and that's a false ideal. Be happy with who you are. And if there is a problem with your weight, speak to someone and get help. Join a gym, get a personal trainer, and have people guide you to lose weight the right way. Or a lot of instances, these women are the perfect size for the perfect weight that they are. There's no need to lose weight. Again, it's all false imaging from magazines to convince people they need to be a size 000 or 00 now. Okay. The next slide deals with suicide. Now, suicide is a condition or situation where people get really upset and decide to end their own life. Okay? Suicide is not a solution for any condition or a solution to any life problems. In most instances, people suicide, they think that people's lives around them are going to improve because of their not being in their lives anymore. And that's not the case. People that love you are affected by suicide. If you feel like you want to hurt yourself, you want to end things, seek medical help right away. Speak to someone, figure out the problems, and understand that you're trying to get back at something or trying to hurt someone by killing yourself doesn't hurt that person. It just makes, it only hurts the people that love you. A lot of times the people you're mad at and you want to kill yourself because they've made you so upset don't care about you enough in the start to care if you're dead or not. Okay? It's only the people that truly care. If you're in a situation that you can't deal with, call a suicide help hotline and get help right away. And just remember, we live in America, which is one of the greatest countries in the world. No matter how much your life sucks where you are now, it can be improved quite easily just by leaving the situation and going to a different state and changing and reinventing and doing things over. Your life will get better. There's no reason to lose or to end yourself. Okay? So again, if you need to talk to someone, get the help that you need. Okay? Treatment for suicide, people who have suicidal ideations, is to discuss the problem and figure out what's going on and find a resolution. Sometimes it may involve hospital stays, it may involve medications to help with depression and help people understand that life's one of these things that you can't control everything and bad things do happen. But it's up to you to determine if you want to let that bad thing take over, or you can turn things around and improve your quality of life. It doesn't matter if you lose all your money, you lose your house, you can always be you and be happy and find a new solution. Okay? Suicide isn't the way to go. Okay? Alright. Now there are warning signs for suicide. Depression, anxiety, you start thinking about self-harming yourself. If you have conversations with people and they start telling you they're having these feelings, it might be a good idea to help these people get help by taking them to, or encouraging calling a suicide hotline, or taking them to medical care. Don't just assume it's a phase people are going through. If it's an assumption that it's a phase they're going through and you ignore it, it could be something that could become worse. Normally people feel like the world would be better off without them, but they don't act on it, they don't dwell on those feelings. People that do and they discuss it over and over again are potentially suicidal, so need help. We see a lot of suicidal ideations in younger people. Okay, ideations are there, they don't act on them. But the thing is, some of these younger people do act on them. We've had situations where suicidal patients of 8 or 9 years old of age have killed themselves because of these ideations, because of bullying and other things that are happening in their lives. There's always some incident or something that's caused them to feel depressed, and it exacerbates and makes it worse. Speak to kids, speak to people that have problems and find out what the issues are, and try and help and improve those situations by getting them the help. A lot of times people feel that just by talking to them, you are qualified enough to help them through that. Unless you're a professional healthcare worker working in mental health, you aren't qualified to help people through these situations. You may be qualified enough to get them to the help that they need, and that is the best thing you can do. Talk to them, help find out there is a problem, and take them to somewhere where they can get the treatment they need to help survive. Most hospitals will give 24-hour observations, or most centres have places that they can refer you to where they'll have people who are professionals and deal with just the situations you have. In Naperville, for example, there are treatment centres that deal with patients who are children, patients that are younger adults, and then patients that are geriatrics. So there's segregated, separated, and they have healthcare workers, psychologists that deal just with them, and they're around people to try and help them. Also, there's support groups out there to help people deal with their problems and not fall back into the suicidal ideations. Okay. Now, figure 16-10 talks about suicide mortality rate per 100,000 people, and we see that some countries have really high suicide rates. For example, India has one of the highest, where 20 per 100,000 people commit suicide. The United States and Germany are second, with 12 to 15 people per 100,000 committing suicide per 100,000 people. Ethiopia, Nigeria, Iran, third world countries tend to have a much lower suicidal rate. One of the reasons Brazil's suicidal rate is so low is the fact that a large percentage of people in Brazil are Catholic. In Catholicism, suicide is a mortal sin, so less likely to commit suicide because it's a religious no-no. Okay? So again, be careful. It doesn't matter where you are in the world, people still do commit suicide. Identify them, figure out what the problem is, and get them the help that they need. Okay? Chart 1611 discusses percentage of suicide deaths that are caused by self-harm, and we unfortunately tend to find that the majority of people that hurt themselves are in the 20 to 30-year-old age mark. Okay, so that's when they're most likely to try and kill themselves. So again, these are the people that need help, need attention, need discussion. If there's a problem, try and help them find the correct solution and help them find someone that can help them get them through this. Okay. Figure 1612 is a rate of deaths from self-harm. Unfortunately, we see a lot of people killing themselves as they get older because they can't deal with the situations where they take too much medication or they fail to take medication. So we tend to see a lot of people dying as they get older. Again, it doesn't matter what age you are, if you need help, seek help. If you have people that are older, talk to them and find out what they're going through. Everyone goes through something. You aren't qualified enough to help them through that. So as long as you can identify a problem, take them to someone who can help. Suicide prevention is the next slide. 2% of adults have thoughts of committing suicide on an annual basis. Of that 2%, 0.7% think of how they would commit suicide. They have a plan, and 0.4% of that 2% actually make that attempt to commit suicide. Now, one of the things that we noticed is that people that are suicidal tend to be depressed, and then all of a sudden they jump out of the depression, they start having happiness, or they feel different, they feel happy, because they've now come to the realization that they want to kill themselves. So just because you see someone who was depressed feeling happy, or they were suicidal and happy, it doesn't mean that they're not in trouble, there's no problems are happening. Ask them why they're feeling happy, and again, if they tell you it's because they want to kill themselves, I would take them at their word and get medical help for them. If they won't voluntarily go with you, you can dial a hotline or a hot centre, and they may have someone come to your house and help facilitate that transition to care that they need. Globally, 20 suicide attempts and other fatal acts of self-harm for every one reported suicidal death. So what that means is that for one person that's killed themselves, 20 people have actually tried to kill themselves or try to have self-harm. So again, these are things that we have to try and improve and help those situations. We're more likely to get help in developed countries than non-developed countries, but again, the only way to get help is to ask or find out if someone has a problem and try and take care of it. Okay? Right. Figure 16-3 is percentage of adults reporting suicidal ideations, and we see that suicidal ideations again is 2% of the population. Suicide attempts is less than 0.5% of the population. But again, you don't know who's going to try and who's not, so always discuss and figure out what's going on and get people the help that they need. Now the last section we're going to be discussing is autism and neurodevelopmental disorders. Now, a neurodevelopmental disorder is a disorder that a child has where their brain doesn't develop properly as they're growing up or developing as they get older. The most common one that we see is attention deficit hyperactivity disorder. After that, we've started seeing an increase in autism, and there's some intellectual disabilities as people get older, low mental function, mental acuity. Now, one of the things that we've noticed is that ADHD, attention deficit hyperactivity disorder, and autism are on the increase. And that isn't necessarily that they're on the increase, it's just now that we're able to diagnose them better and identify them at a younger age as opposed to misdiagnosing them or not seeing the problem or condition in the first place. Okay? Now, unfortunately, autism is one of these conditions where people have a lifelong challenge in communication with other people or social activities. This is present from birth, and it just progresses and gets worse and worse over time. Now, there was a myth that this was caused by vaccines. Unfortunately, that's not the case. Autism usually happens as a neural tube develops as a child, growing inside the mommy. When the baby comes out, autism's there. The good thing is if we diagnose it early, we can find treatments and find ways or methods to try and reduce the amount of autism that's there or presents itself and improve that child's quality of life. Okay? 1 in 130 people worldwide are falling on the autistic spectrum. Now that doesn't mean that each of those people has severe autism. It just means they have difficulty with social communication. Okay? Some people have it so severe that they can't talk to anybody or look at people or interact or be touched by anybody. Other people just feel really nervous about talking to people or interacting with others. Okay, so there is a spectrum that people are on, and we have to diagnose them on that spectrum and find treatment and find care as soon as possible. Okay. Next we have dementia and other neurocognitive disorders. Dementia is one of these situations where everybody becomes dementia or develops dementia as we age. The longer you live, the more likely you have some degree of dementia, whether it's forgetting where you put your car keys, where you put your glasses, or something, for example, not forgetting to turn the stove off. Your memory starts to go as we get older. Now, we see dementia manifesting at about 60 or so years of age, and it's usually about 5% of the population starts developing that form of dementia at that point in time. Now, the prevalence of dementia is, like we said before, is the older you live, the more likely you're going to develop dementia. The good thing is if your brain is functional and you're constantly thinking and constantly being active and constantly having to use your brain, the amount of dementia that you undergo is much reduced than it would have been. So studies have found that people that do adult colouring books, where you colour pictures as an adult, are less likely to develop dementia or severe dementia than people that don't engage their brain. Doing Sudokus, crosswords, jigsaw puzzles, or doing anything that keeps you active will reduce dementia. Okay? Now, another condition that we see is Alzheimer's disease, which is a prevalent form of dementia. The difference between Alzheimer's and dementia is that Alzheimer's has organic lesions within the brain that occurs that prevents them remembering or acting properly. Now, with Alzheimer's patients, 2/3 of them were diagnosed with dementia, and it just progressively got worse. And it's usually because the brain pathways don't function properly and they can't access the memories. They know there's something they should remember, they just can't access it, and it creates frustration and anger. These people with Alzheimer's also develop mental attributes that develop as hallucinations, whether it's visual or auditory, see things that aren't there, or hear things. Dementia is a situation where we can provide care. Alzheimer's is as well, but again it's more structured with Alzheimer's. We can try and reduce the amount of the effects of it, but once you have Alzheimer's, it just progressively gets worse over time. So the idea is to get treatment earlier and try and improve your situation to reduce the amount of Alzheimer's that you get. We currently believe that by 2030 in the United States, or sorry, by 2030 globally, there'll be 60 million people globally with Alzheimer's disease or dementia. Okay. Next slide is traumatic brain injury, or TBI. Traumatic brain injuries can be short-term or long-term damage to the brain. Short-term traumatic brain injuries are recoverable. Symptoms can last several days, hours, days, minutes, months. Severe can cause death. So again, any sort of brain injury has to be seen by a physician, a neurologist, to determine how bad it is. It can be improved on. The sooner we can diagnose the problem, the more likely you'll get treatment and survive. Okay. Last section is mental health care. Now, most mental illnesses are treatable, whether it's through medications, where you're taking medication on a daily basis, therapy, where people are talking to you, where you find the cause of your problems and you try and improve them, or social rehabilitation, where you deal with the structure of your life differently, so it's no longer something that affects you in a mental way. The big thing to understand is that everybody is susceptible to developing a mental problem. Okay, a lot of times we have them and it's undiagnosed, and we go through areas of depression and we snap out of it and become normal again, and it just comes back later. If there is something wrong, get help. Everyone should get help. Even if you don't think you have an issue, you discuss it with someone, you may find an issue arises, or there is something you're trying to deal with. A lot of times it could be grief, loss of a loved one, loss of a pet. It can be just the situation you're in. So again, if you feel that something's wrong, get help, get a solution. If you can't do it by yourself, call someone to help you get you through this, to contact suicide lines, to get you through help groups, functional groups, which is very easy to do in the United States, not as easy in the rest of the world. But we live in a country where we can get the help if we need it, so please get that help. Okay. The last section, the last slide, discusses healthcare professionals. Psychiatrist is a physician with advanced training who's going to get you the help that you need, who's going to prescribe medications. We have psychologists. These are people who give you counselling, try and help you through the problem. And then we have nurses and social workers. Now, these are people that have treatment or training, in mental health care. The regular nurse on the unit floor hasn't had enough training to give you competent mental health care. A nurse on a psych unit has. So if you haven't had that degree of training, you can identify the problem and help find people get to the solution that they need. Okay. Less than 1/2 of adults with severe mental illnesses receive any mental health care services, which means a lot of people walking around out there with problems that need help. So what we need to do is try and find these people and give them the help and assistance that they need to make their quality of life better. And it's not just them. When they get better, their families get better. The situation around them improves. And people will live longer and healthier because their situation is good. So be an integral part of that and help people understand that there's nothing wrong with them that can't be fixed. There's just a short-term problem that's rectifiable. So we need to try and do that. Okay? Low-income countries have a much higher incidence of mental problems and lack of care. It's believed in some countries there's 100,000 patients for one psychiatrist in third world countries. So again, if you're coming from one of these countries, you're going to these countries, realize there are problems and they can be fixed. Okay? Thank you. Hope this presentation helped. Stay healthy.